So good day, ma'am. My name is Francis Mercado from BSN2B, and today I'm going to be your student nurse. So may I get your complete name, ma'am? Okay, that's great. So now, ma'am, I'm going to conduct a procedure which is LEOPOLD'S maneuvers. In this procedure, ma'am, I'm going to place my hand on your abdomen. Is it okay for you, ma'am? Okay, that's great. So, Leopold maneuvers are used to palpate gravid uterus systematically. This method of abdominal palpation is of low cost and easy to perform and non-invasive. It is used to determine the position, presentation, and engagement of the fetus inside the utero. So, Leopold maneuvers are usually performed after 36 weeks by your healthcare provider to determine your baby's position and estimate their birth weight. This will help you and your provider be better prepared for your labor and to determine if it might be safer to perform a cesarean section. So before we begin the procedure, ma'am, I need you to empty your bladder so that you might not feel uncomfortable during the entire procedure. Okay, ma'am. So now I'm going to position you in a dorsal recumbent position, and I'm going to close the curtain to provide privacy for my client. And now I'm going to drape the client and expose only the part that will be needed in the procedure. So, ma'am, I'm going to lift your gown. Is it okay for you? Okay. And next, I have to perform hand washing to protect myself from any infection as well as my clients from cross-contamination. After washing your hands, dry and warm them by rubbing your hand to each other and place them on the abdomen. The purpose of this is to avoid a muscle contraction. So before we start the procedure, I'm going to wear my glove first. Okay, that's it. So now let's start the first maneuver, which is the fundal grip. Fundal grip permits determination of the uterine fundus level as well as the fetal presentation. The uterine fundus is palpated by flat hands which are placed in such a manner of the abdomen that fingers of one hand are facing the other finger on the other hand. When performing fundal grip, face the woman's head and place both hands flat on the upper abdomen and palpate gently to detect which part of the fetus lies in the fundus of the uterus. Okay. When palpating, a head feels more firm than the breech. A head is more round and hard. The breech is less well defined. A head moves independently of the body, and the breech moves only in conjunction with the body. And next is the second maneuver, which is the umbilical grip. Okay, now palpate each side of the abdomen to detect the location of the fetal back and fetal small parts. Hold the left hand stationary on the left side and the uterus while the right hand palpates the opposite side of the uterus from the bottom to top. Okay. Then hold the right hand and steady and repeat the palpation using the left hand on the left side of the uterus. Okay. This method is the most successful to determine the direction the fetal back is facing. One hand will feel a smooth, hard, resistant surface, which is the back, while on the opposite side, a number of angular nodulation, the knees and elbows of the fetus will be felt. So next is the third maneuver, which is the PAWLICK'S grip. Palpate the lower abdomen gently by grasping the area just above the symphysis pubis between the thumb and the index finger. Okay. And try to press the thumb and the finger together, determine any movement, and whether the part is firm or soft to detect what occupies the pelvic inlet and whether or it is engaged. This third maneuver. This maneuver determines the part of the fetus at the inlet and its mobility. If the presenting part moves upward, so an examiner's hand can be pressed together. The presenting part is not engaged or not firmly settled into the pelvis. If the part is firm, it is the head, then it is the breech. Next is the fourth maneuver, the pelvic grip. Facing in the foot part of the client, palpate the abdomen by placing fingers on both sides of the lower abdomen, approximately 2 inches above the inguinal ligaments, and press downward and inward in the direction of the birth canal. Allow fingers to be carried downward to detect head's degree of flexion, position, and even station. This maneuver determines the fetal attitude and the degree of fetal extension into the pelvis. It should be done only if the fetus is in a cephalic presentation. Information about the infant's anteroposterior position may also be gained from the final maneuver. After performing all the procedure, inform the client of the result. And next, I'm going to wash my hands. And after washing my hands, I'm going to cover the patient's abdomen by pulling the blanket down and to provide the client privacy. After all the procedure, you may now document the findings on the client record.